I am presenting a 33-year-old pregnant white female with a family history of obesity and heart disease. She would like to increase her possibilities of having an unmedicated, low-intervention pregnancy, labor, and birth experience by keeping her weight controlled and her overall health status stable or improved. She would also like to solve heartburn issues and continue to keep her blood pressure down. About 5 years ago, she had a benign tumor removed from her liver and had her gallbladder removed. Complications led to kidney failure, daily dialysis, and even the possibility of needing a kidney transplant. She also has a history of endometriosis. At 5 foot 8 inches and 212 pounds, she has gained 5 pounds during her first trimester of pregnancy, with her pre-pregnancy weight of 207 and BMI of 31.4. Her estimated caloric need is between 1,800 and 2,000 calories per day, which will increase to about 2,300 calories per day once she enters her second trimester. Her estimated protein need is 100 to 110 grams per day, and her estimated water intake need is about 100 ounces per day. Her current diet consists of about 50% restaurant and takeout foods, with a high intake of breads, pastas, and butter. She strongly believes in Juice Plus capsules and seems to depend highly on them rather than eating an appropriate amount of vegetables. Recent lab work shows a borderline low vitamin D level, and her blood pressure was found to be very high at 180 over 110, which she blamed on personal stress as the cause. She was given Inderal to reduce blood pressure for a short amount of time, but once the stressor in her life was removed, blood pressure did return to normal, and the medication stopped, but her OBGYN will continue to closely monitor her blood pressure. At the time of her nutrition-focused physical exam, her blood pressure was normal at 120 over 80. Other medications she is currently on are Zoloft for mild depression and Prolosec for heartburn mentioned earlier. She currently does not exercise, and her overall stress level is about a 3 out of 10, and she is very motivated to change her diet and lifestyle as it will benefit her pregnancy outcome. There are no red flags with this client's signs or symptoms. Her core imbalance is digestion because of a diet consisting of high amounts of low-quality carbohydrates and fats. As mentioned, she is overweight at 212, and she is in her first trimester of pregnancy. It is of utmost importance that she gets nutrient-dense foods while not exceeding her required energy intake of 2,000 calories. She also gets regular bouts of heartburn, her gallbladder was removed, and her liver and kidneys health are questionable. I am interested in recommending a CMP to assess the health and function of these organs. Her nutritional status is at risk. Because she is overweight, she has to monitor her blood pressure because she just came off of her medication, and her diet is high in carbs and fats, with less than 3 servings of vegetables and less than 2 servings of fruits each day. The PES statement I created for this case is excessive fat and carbohydrate intake related to the frequency and serving size of high carbohydrate and high fat foods as recorded in her food journal, as evidenced by a pre-pregnancy BMI of 31.4, a 233% carbohydrate intake, and a 351% fat intake as related to the required amount. I chose excessive fat and carbohydrate intake as the main nutritional problem because while carbohydrates and fats are an important source of energy and nutrients while pregnant, the amount and types of carbs and fats she has been choosing to eat were causing her quicker weight gain than required during the first trimester of pregnancy and in reference to her overweight status. The evidence of this problem is shown by her pre-pregnancy BMI, as the BMI calculation during pregnancy is not an accurate assessment. Further evidence is shown by her 3-day food journal, which shows a carb intake averaging 233% or 230 grams per day, when the estimated requirement is 95 to 100 grams per day, and a fat intake average of 351% or 115 grams per day, when the estimated requirement is around 33 grams per day. The overall expected outcome goals for this client is to gain a total of 15 to 20 pounds for the remainder of her pregnancy, giving a total weight gain of 20 to 25 pounds. This is an appropriate weight gain according to her pre-pregnancy weight of 207 pounds and will increase her chances of having a healthy pregnancy and birth. My client is concerned about gaining too much weight during pregnancy because of her love of bread, pasta, and butter. She feels she relies on these foods to satisfy her and to get her through the day. She agrees that changing her diet to a more appropriate carbohydrate and fats will slow her weight gain, and she also understands that getting proper nutrition will help her feel more energized throughout the day. The changes made to the diet in working towards this goal will aid in the healing and improvement of her digestive system. First, we will focus on slowing and stabilizing her weight gain by reducing current caloric intake. Only about 3 to 5 pounds recommended to be gained during the first trimester by a woman of healthy weight. Considering my client is overweight, a total weight gain during the first trimester of 0 to 3 pounds would have been a better start. Her calories need to decrease or she will continue gaining weight at too fast of a rate and ultimately gain too much weight over the full pregnancy. Gaining an excessive amount of weight while pregnant can lead to pregnancy and birth complications, such as gestational diabetes, preeclampsia, and a high intervention labor and birth and possible C-section. Reducing overall carb and fat intake while improving the quality of those foods that she does eat while increasing her protein will be key in reaching this goal. She will also start taking the recommended supplements, which will improve digestion, relieve the earlier mentioned heartburn, and replenish her vitamin D stores. The first dietary intervention for my client to focus on is to reduce her caloric intake from about 2,400 to 2,000 calories per day. At the time of her intake session, she was in her first trimester of pregnancy. Her required caloric intake should have been the same as her pre-pregnancy requirements. Once she enters her second trimester, her calories can go up about 300 calories more to 2,300. A second dietary intervention is to increase fruit intake to 2 to 3 servings, increase vegetable intake to 6 to 8 servings, and whole grain intake to 4 to 5 servings per day. These foods replace the lower quality carbohydrates and fats, such as the breads, pastas, and butter, which her current diet consists of. This will aid in slowing down the weight gain, but also increase micronutrient intake. It will also increase her fiber intake, which is beneficial to pregnant women, as constipation is common due to hormonal changes and fetal growth putting pressure on the large intestines, colon, and surrounding organs. Her follow-up session should be about 2 weeks from the initial visit. It will consist of going over the successes as well as the failures of the previously mentioned interventions. If any of these interventions weren't successful, they will be modified in order to achieve the previously mentioned goals. Her weight gain over the 2 weeks will be assessed. For weight gain goal to be achieved, she should have gained about 0 to 1.5 pounds since the last visit. If more weight was gained, caloric intake will be modified. The food journal will be assessed as well to ensure adequate carb, fat, and protein quality and intake. Blood pressure will be taken to assure it is still in the healthy range, and supplement intake will be reviewed and modified if needed.